Thank you, Governor and Commissioners, for joining us tonight. My question has to do with the public health infrastructure that up till now has been funded through the Fund for Healthy Maine with its tobacco settlement. I saw on some of the reports you had for our Department of Health and Human Services budget that it referenced comparing us to other states, and I'd love to see you reference our use of tobacco settlement money to other states. We're one of the few that uses it for public health prevention. Additionally, we're one of the few states that doesn't have a formal public health infrastructure and relies heavily on community organizations to make sure that information gets out. So if you remove those funds to fund your Medicaid gap and not using it for public health and education, when we talk about kicking the costs down the road for a generation, the preventative costs will be higher healthcare costs down the road. So how are you planning on assessing public health and the information that needs to get to our population to reduce the healthcare costs that you're trying to address in the budget?
Okay. I have a choice. I'm given so much money to work with. And with the money I have to prioritize. And you go down and you set the priorities, and then you spend until you run out of money. So right now, people with mental illness that are institutionalized are on top of our list. Second is nursing homes. Third is assisted living people. And we ran out of money when we got to them. So the fact of the matter, folks, is not that I am cutting anything. The fact of the matter is I've taken the money that was given to us, I'm stretching it as far as we can. And before I put somebody out on the street, I will use the fund for Healthy Maine. Because it's either closing this
Commissioner Megan, would you like to say anything?
Sure. And I will ask the media if you don't mind to stay to the sides, that way our guests can see the front panel. I think the governor has truly captured very effectively the choices that we have. I would also just emphasize that the tobacco settlement that is the origin behind the Fund for a Healthy Maine, it was due to tobacco-related illnesses and the financial impact on states. And certainly within our Medicaid program, we are continuing to experience those costs. We are investing in primary care and prevention within the Medicaid program that also needs to receive ongoing support so that we can improve the health outcomes for the individuals we serve. But I also want to be clear, Maine has made significant investments using the Fund for Healthy Maine in ways that many other states did not. And that does go to your point about investing in prevention, tobacco prevention and cessation, unlike other states that perhaps used it far afield from its intended purpose, at least in terms of health and health prevention. We also need to look at other dollars we receive, certainly from the federal CDC, the Centers for Disease Control, and make sure that those dollars are being wisely used and invested. But there is no doubt this is a matter of having to choose between the kinds of services that are today being supported by Medicaid and the funds that currently are being used for the Fund for Healthy Maine.